Your arms or legs swell. You're in pain. What could it be? Experts say it could be lymphedema, a condition more common than you might think, affecting millions and lowering their quality of life. In our cover story, Rod Starnes shows you how therapy can help treat this condition and help those hobbled by lymphedema get a spring back in their step.
Just one look at Patricia Sharp's legs, and you can just imagine the amount of discomfort she's experienced. Patricia suffers from lymphedema. Your lymphatic system moves lymph fluid through the body to keep other fluid levels in balance and to help the body fight infection. If the flow of this lymph fluid is blocked for any reason, such as the lymph nodes being removed or damaged, the fluid can build up and cause major swelling to occur.
It can be caused by several different things. Usually the patients I see are secondary lymphedemas from some type of trauma, surgery, breast cancer surgery, colon surgery, things like that. It's as the result of some kind of trauma or surgery. And then the primary lymphedemas are more of a congenital problem that can show up at birth or later on in either men or women.
While Patricia has had several recent surgical procedures, the exact cause of her lymphedema remains a mystery. Regardless of the cause, the pain and discomfort she experienced from the swelling was real and needed to be managed.
It really stopped me from doing a lot of things. I stopped being able to go to church, attending any functions like a wedding, that sort of thing. My legs were so big. It was like my calves were like basketballs, and they just looked so bad. And I couldn't wear any shoes, normal shoes, and just couldn't do much of anything. And it was hard to get around.
Things looked pretty bleak for Patricia, but then she happened upon some information that proved to be life-changing.
I went to the Handicap Unlimited one day for supplies, and one of the bosses there started talking to me, and he said, your legs are swelled. And yeah, it was obvious, even though I had pants on. And I said yes, and the reason I don't have any compression hose is I can't get any to fit me. And he said, oh, we can help you with that.
That's when Patricia started physical therapy sessions with Sandy.
We did a technique called manual lymph drainage. With manual lymph drainage, we can actually stimulate the lymphatic system to move more fluid than it normally does. After I did that for about 45 minutes, I did a compression bandaging. It's multi-layered. It looks like an ACE bandage, but it has a very short stretch, specifically for lymphedema. And she wore that from treatment to treatment.
Patricia noticed a difference right away.
My legs responded really well, and I was thankful for that. And I don't have any infections in my legs, so I'm thankful about that too. But I'm able to walk so much better. I can get in and out of the car better. I can get up and down steps better. I feel like I have a new lease on life.
And that new lease on life has not only added a few steps in the physical sense, it's added a few steps to Patricia's itinerary as well.
I want to go back to church and start doing some things that I haven't been able to do. Well, I'm looking forward to going to the shoe store and finding out what my real shoe size is now, and maybe getting some real shoes.
For Smart Medicine, I'm Rod Starnes.
Joining me now is surgical oncologist Dr. Guy Fotopoulos of the Wound Center at Baptist Rehab in Germantown. And Dr. Fotopoulos, thank you so much for joining us.
Thank you very much.
We are here today talking about lymphedema. Now, clearly most people would go see their doctor when they see these kinds of symptoms. What are the hazards of ignoring these symptoms?
The problem in ignoring that is primarily the skin breakdown. Skin gets very tense, kind of like a tire that's swelling or almost a blowout. If there's a scratch or irritation, it can ulcerate, and the ulcer can grow very quickly. And it may take a short time to prevent that, but up to 5 months to a year to heal it.
And what are the benefits of treating it?
To reduce the swelling, protect the skin. Also, the swelling can get so large that if it's in the arm or the leg, it actually, just the size of it, getting around, the mobility and so forth becomes a problem as well.
Now, cancer patients, I understand, suffer with this and struggle with this quite often. Why is that?
That's because, number one, the cancer can actually affect the lymph nodes and cause swelling, and that's how sometimes the cancer is found as a result of the swelling. Or even the treatment, removing lymph nodes surgically from the axillary area for breast or in the pelvic area for prostate or cervical cancer, radiation therapy, that affects those lymphatics, blocks them. Again, just like the plant, the lymph vessels no longer are taking the fluid back, and the fluid then just stretches and stays in the limb.
Dr. Guy Fotopoulos, thank you very much for telling us about lymphedema.
Oh, it's a pleasure. Thank you.